Dan Domenech is the executive director of the American Association of School Administrators. He's leading a task force that is assisting schools all around the country with their plans to reopen safely, and he joins us now. Good morning to you, sir. The stakes could not be higher here. We heard some teachers talk about how it's a life or death choice for them going back to the classroom. So how are you advising schools to weigh the benefit of in-school instruction against that risk that could really be catastrophic?
Well, good morning, Tony. And absolutely, we have been talking to superintendents from all over the country for the last couple of months, trying to come up with how to reopen schools safely. And that is the primary concern, safety. So we are concerned about the safety of the students, but also the safety of the staff. So we have a number of plans, and you're seeing that happening right now in terms of what districts have announced is going to happen when school opens. There are basically three plans. The one is to come back as if nothing has happened, which, by the way, some districts are considering, and I don't know why. The second one is this hybrid model, where basically students come in for a couple of days a week, then they're home, so that this way you can try to get to all of the kids in the building. And the third one, which we're also beginning to see, particularly in districts around this Washington, D.C. area and other parts of the country, is that it's not safe yet, and therefore remote learning is going to continue. But safety is the primary factor. We're using the CDC guidelines primarily in terms of outlining for us what is safe. We want to make sure students are safe, and we want to make sure that staff is safe.
Yeah, Dan, in those three categories that you just outlined, I'm curious, with the tens of millions of students all around the country waiting for an outcome, who is in what category, and how big are the three categories? Like, how many states and school districts might be going back with very few precautions, how many in that middle position, and how many not going back at all?
It's interesting, Tony, how things are changing. I can tell you that a month ago, in talking to many of our colleagues along the Southern Belt states, at that point, they were considering in just opening schools, so come one, come all, in many cases without any precautions in terms of spacing or face masks. That's beginning to change now, and we're beginning to see even governors in those states, like Kansas as an example, indicating that face masks are mandatory, postponing the opening of schools. The primary thing here is you want to open schools according to what was phase 2 from the White House a couple of months ago, and that is when the epidemic, the rate of infection is going down, not going up. Oh, and when you do that, that you have the social spacing and all the other precautions.
Yeah, but there are maybe most states right now are either stable or going up in case count. So if we go by that indicator, I mean, most places are not going to open. I have a question from Jessica in Indiana, a viewer who also believes is a teacher, and she wants to know simply, why are we even talking about going to the classroom at all? Why sacrifice, in her view, the health of teachers and students and maybe families when e-learning is an option?
It is an option, and you're seeing more and more districts doing that, announcing that they are going to open, but remotely. The key thing here are the conditions, the rate of the epidemic in that community. If it's going up, you don't want to open. If it is going down, if it's minimal, if things are stabilizing, then opening following the precautions listed by the CDC are important. The 6 feet spacing between children, wearing of masks, and all of those other factors. So it really has to be determined by the community, but it has to be when it's safe to open, not the condition that we see in many states where the infection rate is sky high.
Yeah, if schools make the investment to change the environment and reopen, and then they get a case, does that mean they shut down completely? What happens then?
Absolutely. That's what the guidelines say. If there's a case in the building, a student or a staff or more than that, that building has to shut down. It has to be sanitized, and there has to be a period of time before the schools can come back. Yeah. So you can almost predict that when schools do open, even with the safest of precautions, the minute there's a case, they're going to have to shut down again.
Yeah. I want to get in a question from Tabitha Rossbroy, who happens to be the Teacher of the Year this past year. And she says, look, we know things are going to be different, but what can teachers do to help students feel like this is a normal year in some sense?
Well, you know what? I don't think there's any way you can help students feel that this is a normal year, because it's not. But the reality is that these children, these students, have gone through a lot of issues, stress, problems, and first and foremost, the teachers have to deal with that. They have to talk to their students. They have to make sure that they're comfortable. They have to hear their issues and their problems. Yes, there's been academic loss. There's been learning loss. No question about that. But first and foremost, in addition to the safety and welfare of the students, is their emotional status. And teachers do a very good job in doing that.
Yeah, they sure do. And we should remind our viewers that this is not a federal decision. It is a state and local decision right down to the level of the school district. Dan Domenech, thank you very much for walking us through your position.